When I was a kid, my parents always told me eating too much sugar is bad because of tooth decay. But for some people, eating too much sugar is not just about getting tooth decay. They might die of it. And you probably have heard of these people, the diabetic patients. Inside our body, there's a protein called insulin. If we eat a lot of sugar, insulin will bind to the receptor on the cell membrane and tell the cell, hey, there's too much sugar outside, you need to take some. Then our cells will uptake sugar from the bloodstream and store it and lower the blood sugar level. However, diabetic patients do not have enough insulin to tell all cells to uptake sugar. So there's still a lot of sugar in the bloodstream, which will cause many symptoms like increased hunger or weight loss. Back in the old days, few diabetic patients could survive for a few months after diagnosis. The survivors only allowed it to have an extremely low calories diet, which was about 500 calories per day. Or let me put it in this way, one McDonald's Big Mac per day only. But fortunately, this situation started to change with a physician. In 1889, the physician Oscar Mikowski found out there was a relationship between the pancreas and diabetes. After that, in 1921, Charles Best and Frederick Banting isolated an extract from the dog's pancreas and injected it into a diabetic dog, finding that the extract reduced the dog's blood sugar level by 40% in 1 hour. A few months later, Best and Banting isolated insulin from the cow pancreas, and they invited a biochemist, James Collip, to form an insulin research team. When everything was ready, in 1922, the first injection of insulin was given to a diabetic patient, Leonard Thompson. However, the insulin was so impure that Thompson had to suffer a severe allergic reaction, and the further injection was cancelled. The first injection just brought a lot of criticism to the team, and in the next 12 days, the team worked day and night to improve the purification of insulin. And finally, Thompson received the second injection of insulin and eliminated the symptoms of diabetes successfully. With the first cured diabetic patients, more scientists got involved in the production of insulin, and more patients can survive. So it is time-consuming and stressful to do scientific research, but when the problems are solved, it is all worthwhile. Thank you.